Hello everyone, I am Dr. Seema Gaonkar. I am a consultant neonatologist and pediatrician working at Cloudnine Hospital, Sahakarnagar. I have done my MBBS from Mahe University and MD Pediatrics from Mahe University. After that I have done my neonatology fellowship from the Cloudnine Hospital itself. Spinal muscular atrophy, as the name says, it is the weakness of the muscles around the spinal level. There is something called a central nervous problem, that is a brain problem, or something peripheral nervous problem, that's below the brain, that's at the spinal level problems. These are spinal level problems which we call it as motor neuron diseases. So here the motor neurons have got affected, so they are not giving the signals to the nerves. Because of that, nerves are getting kind of paralyzed or not getting used. When something is not getting used, it will get atrophied or it will get vanished slowly. So when these muscles are not getting the nerve signals or nerve innervations properly, they slowly get weakened or atrophy. That is what is spinal muscular atrophy means in simple terms. So is it very devastating disease? Yes. So sometimes yes, really devastating disease, because actually there are many types in SMA, what we call spinal muscular atrophy. There are actually 4 types and it is a genetic problem. Genetic problem means there are some inheritances which we say, like if the mother or the father has it, there is particular chance for a child to have it. If they both have the genes, there is a particular chance they have it. So this is that kind of disease where we tell it as autosomal recessive disorder. So when that happens, they will have, the baby may have, actually what I said, there are 4 types in it. In the first type, it happens before 6 months of age, that's infant type. That is very deadly one, and those babies hardly make it after 2 years. And they will be kind of paralyzed, or their muscles are totally atrophied. They will not attain most of the milestones, or whatever is attained also are lost, and they will not make it mainly because of they are not only about the muscular atrophy, it is other muscles also which get affected, like lung muscles get affected, they get pneumonias, they get aspiration problems, chokings, they will get ventilated and so many other things, and they will not make it usually more than 2 years. SMA2, the spinal muscular atrophy 2, actually happens between 6 months to 2 years of age, and SMA3 happens in the adolescent age. These are the babies who will make it to certain ages of life, but they will always face the difficulties. They are not able to do their normal activities. Their muscles will be worsening day by day. They'll have pain. They will be dependent on the people for simple normal activities. Adolescent one is the lesser one compared to the SMA2, but usually slowly they'll be worsening, and they will need lot of medical, occupational help from the others. Also, they will have breathing difficulties, swallowing difficulties in many of the times, and other infections, urinary infections, pneumonias, choking, aspirations, and lot of bed sores and other infections also are possible with these. So they will need aid or assistance from the other people, or wheelchair bound, or many other things in their life. So the SMA4 usually happens in the adulthood, and this is the most milder form of SMA, in which the patient will not be most of the time possibly wheelchair bound, and they will lead near normal life, and they need minimal occupational and physiotherapies and other things. Whether any cure is there for SMA, mostly there is no medical cure, but most of the time what they need is again a multidisciplinary approach with occupational physiotherapies and wheelchairs. They may need spinal buckles to support them, ambulatory cares they will need, repeated checkups whenever they have get infections or they get any other issues in their health, and they may need to be immediately hospitalized and prevented from getting the major ventilations and other things. And diagnosis of SMA is mostly with the either biopsy of the muscle, or there is a EMG, electromyogram what we say, with that it will be done.